So what are the steps that a patient should take to make sure they find a great surgeon?
So it's interesting, you're right. I mean, I suppose in my practice, the number of people that have properly researched it is in the minority. And the number of people that are just vaguely aware that there are things available is probably still the majority of people. So the situation is that, sometimes when they're shopping, and I describe it as shopping, they come in and say, well, why should I choose you? And they are just going through the Google search or what used to be the yellow pages and just, ticking boxes and interviewing. So effectively, if you're going to be talking, first of all, I think it's important to talk to the surgeon, right? If you're going to contact a clinic, you need to talk to the surgeon. You don't need to talk to the salesperson or the consultant, because their job is to get you in the theatre, because that's how they make a living. So you need to do this. And the journey of hair loss that can begin in the teens for these young men all the way through life. Now, this is a whole of life experience where they are dealing with a progressive condition. So you want holistic care, and this is what the doctor can offer you to tell you at what stage you are, what is likely to happen in the next short period of time, because it's very difficult to be able to predict the long-term outcomes. But if you talk to the doctor about it, it should not just involve about what surgery can do now. It should be about how you manage this problem going forward. So the first thing is you want to talk to the doctor. That's very, very important. Number two, when you talk to the doctor, you want to hear him say it's more than just surgery. Because if you're having a consultation with a doctor and all they're talking about is surgery, then you're in trouble. Because there's no acknowledgement then of the commitment that you have made if you proceed with surgery. I say to my patients, if you take medication and stop, the worst thing that can happen is that you were bald naturally as nature intended. But once I operate on you, if progression of baldness occurs, you are now going to bald unnaturally, and that will have consequences that will force you to actually respond, usually by having more surgery. So again, you want to hear the doctor talk about the risk benefits of operating without medication versus operating with medication, what the benefits are and the risks are of medication. It's absolutely critical.
And I know in my practice, we sometimes manage for years medically before we get ready for surgery. And that's
very common.
That's very appropriate.
It not only is it appropriate, it should almost be compulsory.
Yeah.
That you establish that, because if people don't want, there are a small percentage of patients who come into your practice and say, I don't want to do medication, and you've told me that I'll need top-up surgeries going forward in the future. That's my preference. That's a small percentage of patients in my experience. If you explain the benefits and the ability to reduce the risk of future surgery and therefore cost of future surgery, and the small but significant risk that some patients are going to run out of donor hair sometime in the future, then they'll usually buy into the argument. So that's very, very important to do that educating. The third thing you want, apart from the doctor talking to you about the benefits of medicine versus the benefits of surgery and the benefits of combining them, the third thing you want to do is experience. Now, it's not that people who have been operating for 10 years are necessarily better than people who are operating for 2 years. But what the people who have significant experience have the experience of is watching what happens with progression of the balding after they operate. And that's the benefit there, that they actually understand and have seen it. It's not just some kind of theoretical construct that they get taught about out of a textbook. They actually see it and they actually live the experience. So if you have experience in your surgeon, they are more likely to be very aware of what the long-term progression risks are and how that interacts with the surgical plan and the management plan going forward.